Thank you all for coming right from home, and we're really happy to have you here. So we're going to see why maybe we choose womb rather than another health district. So now I'm just going to tell you a little bit about the top pregnancy with Dr. Nuela. My name is Dr. Nkeh. I'm a medical doctor and the founder of Talk Pregnancy with Dr. Nuela, which is an organization which aims to ensure that women in resource-limited areas, especially areas highly affected by crisis, receive early and equal access to health services during their pregnancy.
I am Dr. Nkeh Edmond, the director of Womb District Hospital. I am here at the multipurpose hall of the regional hospital in Bamenda to learn more on strategies to improve antenatal consultation in the Northwest region. As you might know, it is a fact that the antenatal consultation take-up at especially the Menchum is very poor, and due to the increased prevalence of adverse maternal and neonatal outcomes, we thought it wise to call for help.
This workshop is a very important workshop because it deals with improving antenatal care uptake in our health districts involved in the project. You know, maternal mortality is a public health problem today because many countries in the world today have not reduced their maternal mortality rates. Maternal mortality is the death of a woman while she's pregnant or even up to 42 days after pregnancy. And Cameroon has one of the highest rates of maternal mortality in the world, which has even increased over the past years. And the World Health Organization has identified many factors or many areas where we can intervene to reduce maternal mortality. And one of them is proper antenatal care. So a workshop like this, which improves antenatal care uptake, is a very important workshop.
So this project is actually a project to curb maternal mortality in our community, especially in a conflict setting. So what we have to do is we have to train community health workers, nurses and doctors in remote community, and that is in womb, to be able to identify high-risk pregnant women and refer them earlier. So what these people will do is that they're going to carry out a campaign to actually screen 200 pregnant women in womb to identify complications like infection during pregnancy, that's urinary tract infection, malaria, and preeclampsia, signs and symptoms of preeclampsia, such that if there's any woman with any of these complications, it's going to be identified.
We cannot talk about maternal health without talking about family planning.
Over the years, we've had a serious challenge with our antenatal care coverage for the region. It's been low, barely above 50%. And we, of course, have been looking for strategies to improve on antenatal care. And one of those strategies we believe is to have a community-based approach for ANC, getting to some of the women in distant and far-off places that are unable to reach our health facilities. And within that framework, we are blessed to have this project that will be implemented in the region, which has as focus to reach women for antenatal care and other services during pregnancy, especially the vulnerable women that are found in our community, and to ensure that they receive quality care that would give them the right benefits and right information.
This training with Talk Pregnancy organized by Dr. Nuela and team, I think is very timely because this is what we have always wanted, especially those living at the suburb, to be able to sensitize them well on ANC uptake and labor and delivery. So I think it's very timely because in the past months or years, we have been having increased maternal death and perinatal death. Like for example, last year we had, in this hospital, we had almost 10 maternal deaths and more than 200 perinatal deaths. So you see it's very timely. And the most problems we identified was that those living at the suburbs, they either refer to us late, either late referrals, no idea on ANC and labor and delivery uptake.
So this project is actually sponsored by the Aviva Women in Science Fund project under Open Dreams. Then my expectations for this training is that the people who will be trained are going to be able to have great knowledge on the risk factors on women who have high risk pregnancy, and they are going to be able to know women who have problems early so that they are going to refer them early. So from this, we're going to help them to carry out that project in womb successfully.
And you know, in our region now, we have been plagued by this crisis for some years now, and women have found it very difficult to access antenatal care. And this has caused an increase in the number of maternal deaths we have in our region. So this project is very timely to act at that level to make sure that women will see them on time and try to reduce maternal death and neonatal death in our region.
I'm called Nkeh Buma. I'm a senior medical student in the Faculty of Health Sciences, University of Bamenda, and I'm the very first Aviva Women in Science Fund scholar. I'm also a volunteer at Open Dreams. The reason why I'm volunteering at this project is because I'm someone who is passionate about neonatal health, and maternal health stands at the forefront of bringing forth healthy neonates.
We are here participants from different health facilities in the womb health district to learn on strategies that can help us improve on the uptake of antenatal consultation, and why not optimal uptake of antenatal consultation. We come here with a lot of expectations to take home to help our dwelling population in womb health district.
It's a wonderful experience at the seminar today because it has given me an opportunity to get to realize the difficulties faced in rural areas in terms of medicine and antenatal care. So with such information, it's going to help me to be a better community health worker, to spread the information and help mothers to better realize the necessity of antenatal care and to know why it's necessary to go as early as possible from the onset of pregnancy and avoid some birth complications.
I am very, very impressed. The workshop was wonderful, and I believe what I've learned here, I'll go with it back in the community and do my best.
I really want to thank the organizers of this seminar, this workshop, because it's been really enriching, and we live with our expectations being met. We are very thankful to especially Dr. Nuela, the CEO of Talk Pregnancy with Nuela, for this initiative. We are done with the first phase of it. The next phase is upcoming, and we pray that it should be as successful as today. Thank you very much.
It was an amazing day. In fact, I could feel the Aviva dream come to life. Thank you very much, Aviva Women's Science Fund Scholarship. Thank you very much, Open Dreams. Thank you very much, Talk Pregnancy with Dr. Nuela.
It was quite an interesting training and a very successful training. And we are so happy with the participants because all of them were able to meet up with their expectations that they came with, and from their feedbacks, they have learned a lot of things. They have learned something new, and I think they're ready to impact their community in a better way. And we are looking forward for the campaign in womb to screen these pregnant women, and it's going to be coming up in 2 weeks. And we hope that this campaign is going to be a great success because we trust them that we have trained them so well to carry out this campaign very well. And I want to say a big thank you to our funders, that's the Aviva Women in Science Fund project and Open Dreams, for this opportunity that have given us to be able to impact the community through Talk Pregnancy with Dr. Nuela. Thank you very much.